Hi, Dr. McDougall. So can you tell us like what kind of doctor you are and where you practice, where you're located?
Yeah, so I'm an epidemiologist at the University of New Mexico Comprehensive Cancer Center. And as an epidemiologist and cancer care delivery researcher, I don't actually see patients. I have a PhD and do all research.
Yeah, and epidemiology is in fact like the classy job to have in late 2020.
It is. Finally, people know what an epidemiologist is.
Yes. Do you get restaurant? Well, you don't get any restaurant reservations. So I guess that's not. Well, welcome to the A list of science. And tell us what's your interest around cancer patients and perhaps even specifically prostate cancer?
Yeah, so I have been doing cancer research for over a decade now, and I have always, since I was going to graduate school, worked in cancer centers and worked with cancer patients. And I've always really been interested in understanding disparities in cancer care and understanding why some people do really well and other people struggle a bit more with their cancer diagnosis. And so most of my research has been focused on the financial burden of care, and we have primarily focused on cancers that are among the most common. So obviously prostate cancer has been a consistent focus of my research, as well as breast and colorectal cancer.
So around prostate cancer, like what are some of the struggles that you've been able to identify?
So, as the cost of cancer care has become really outrageously high, we see that a lot of people who get treatment and go through treatment and do really well still end up having a lot of financial burden afterwards that affects them for a long time.
And by financial burden, I mean, are you talking about complete bankruptcy and debt, or how severe are these burdens?
Yeah, early on, we had done a study when I was actually at the Fred Hutchinson Cancer Research Center in Seattle that linked cancer survivor and cancer patient records to bankruptcy records, and found that people with a history of cancer are about twice as likely to report filing for bankruptcy than people who don't have cancer. So we know that bankruptcy is one manifestation of financial burden, but also just taking on new debt, changing spending habits. So for a lot of people, it's not having the money that they used to have in their income if they have to take time off of work, or if they, start spending their retirement. So a lot of it is new spending, or the need to borrow money and go into debt and change financial habits that weren't expected. People aren't expecting to get cancer and don't have a savings for that sort of a diagnosis. And so people end up having to change a lot, and the repercussions can be pretty serious in terms of somebody's financial future.
Yeah, and let's talk about change, because I don't think people understand in a general sort of way until it hits them. Like, it's not just about paying your insurance bill and an occasional copay. What are the changes that cancer causes around financial behavior?
So, for younger patients, we see a lot of times that people have to take time off of work, and it depends how much treatment people are getting, but even the psychological ramifications of having a new cancer diagnosis can mean that people are less productive at work. Maybe they need to take some time off as they're getting worked up with their diagnosis to find out what the true scope of the disease is. And so that can really impact people's incomes. Also, sometimes people will turn down a promotion or turn down, the opportunity to take on new work because they're feeling like they're not sure what their future holds. So for younger patients, we see that often it's tied to employment. For older people who tend to live on a fixed income, maybe on Social Security or savings and things, it can also obviously impact the amount of money that people have. So it's sort of a new change where you see people who have never struggled financially suddenly becoming much more concerned about their financial future.
Yeah. And within our support group network, where, most of the guys are like, late 50s, early 60s, around the newly diagnosed realm, we see sort of a parallel thing of what male care characterizes as a race to get rich. Like, you've had a comfortable life, you've taken care of your family, or you've taken care of yourself if you're single. But then, you want to have a legacy all of a sudden because you realize you're mortal. The cancer diagnosis is a kick in the butt. You're going to die. And, guys just, fighting for promotions or taking on a second job or figuring out a super late stage change in career that may not at all be gratifying, but has a higher income level. And those are kind of, we support whatever a man's choice is and whatever makes them happy. But, there is a toxic quality to that, that it's a shame the cancer diagnosis disrupts you so much that, the 8 to 10 hours a day you work turn into 12 to 16 hours a day just because you need a bigger number in your bank account.
Right.
Yeah.
And I think on the flip side, you see people who, stay in jobs that they don't necessarily love because in the US, at least, insurance is so tied to your employment. And so some people may feel like they would like to retire, or maybe they would take time off and do things that they really want to pursue, but end up staying in a job that they may not love out of necessity to keep that employer-sponsored insurance.
Yeah, and it also plays out would you say, let me just ask you, does it play out for the spouse as well? If there is a spouse, that sometimes the spouse who's, comfortably unemployed for his or her life, the partner or spouse now feels compelled to take a job to pay for things.
Absolutely. I think that across the board, we see cancer impacts not only, the person who has it, but all of their family and friends and network that they have that need to sometimes make changes to their life to accommodate either a new diagnosis or treatment, or the need to support that person in various ways, both economic and sort of emotionally, and to be there for them. So I think, yes, we often involve caregivers in the studies that we do when we look at the financial consequences of cancer.
Yeah, and I could see that like our half-hour talk or hour talk is going to be very dark and depressing, so I'm going to try and figure out ways to sort of brighten it up a bit. But there's reason for it to be dark and depressing because it is a really bad part of having cancer, particularly in countries such as the United States, where there's no national health care, and that's a kettle of fish for another meal. But the idea of having to pay for stuff, that your life depends on, and it's not just, a can of pop, it's, big, expensive things that have to be repeated week after week, month after month. I mean, I wish there was something bright around that. Let's go even darker, perhaps. Maybe we could dig ourselves out. The idea of homelessness. Have you seen a correlation between cancer diagnosis and increased homelessness?
Yeah, we often talk about, financial insecurity, and we have looked a little bit at housing instability that comes around cancer diagnosis. Now, it's hard to parse out for people who, perhaps were experiencing homelessness or housing instability before they were diagnosed with cancer and then afterwards. And so I think what we see, though, is certainly when people's finances end up changing because they are now paying for treatment or paying for transportation to go to appointments and those sorts of things, you do see that housing instability becomes a problem. And people who have cancer are more likely to report losing their homes or having to change their place of residence because of their cancer diagnosis or, the costs around their diagnosis than before.
Yeah. What kind of choices do you see people making around paying for things?
There's a real trade-off between, basic needs and being able to afford care. A lot of people, even those who are insured, tend to have quite high deductible plans where they may have to pay a lot out of pocket before their insurance kicks in. And so that can be the difference between making all of your bills that month and being able to pay for medical care, which in a long-term disease where people have, medical bills that are hitting every month now, as well as their regular bills. So being able to maintain your standard of living becomes difficult. And I think that there are choices that different people will trade off differently depending on how they feel about their disease and getting treatment, and whether the cost of medical care is the most important thing, or maybe they forego medical care in order to get the bills paid on time.
Yeah. Are there any 50% of people will sort of not do a doctor meeting just because they can't afford to?
Yes,
anything around?
We see, it depends how you look at it, but for people who report some financial burden, we see that they're more than twice as likely to forego their medical care because they can't afford, to pay for both their bills and their medical care, compared to people who don't report a financial burden. So we know that people are making that trade-off between, being able to afford all of the things that are in their budget and getting treatment.
What about food?
So we recently did a study here in New Mexico where we did a survey of people who had been diagnosed with either prostate, breast, or colorectal cancer. And we found that 36% of the people who we surveyed reported that they were food insecure in the 12 months after their diagnosis. So by food insecure, we mean that they were unable to afford or access healthy food for all members of their family, at least sometime during those 12 months after diagnosis.
Yeah.
And 36% is high. It's a lot higher. In the United States at the time, it was about 11% of US adults are food insecure. So compare that to the 36% in our study. And we're pretty sure that people with cancer tend to, have a higher prevalence of food insecurity than just your average person in the US.
Yeah, in a practical way. Food insecurity means not having food to eat. Is that fair to say?
Yes. Yeah. It means not having the ability to get enough healthy food. So sometimes people can access food, but they're not necessarily getting what they may need for a full balanced diet and to do all of the things that they want to do.
So, give me an example of, what people are eating when they're within that 36%.
So often when people don't have, the resources, whether it's the money to buy all of the food that they want to buy or transportation to get to a grocery store, because of course, in a lot of rural areas, even accessing food can be an issue of, there aren't healthy produce and fresh vegetables and things necessarily in a local store. You may have to go, into town quite a bit farther to find a grocery store. So when people are in that situation, often they are eating food that is sort of your pantry staples, things like rice and pasta and that sort of thing. And there's nothing wrong with that, but certainly the quality of somebody's diet isn't as high when they aren't able to access a variety of foods.
Right, and canned goods usually have a great deal more salt and sugars or sugar substitutes.
Exactly.
Yeah, I mean, it's extraordinary that while we're taking good care of people in rural areas around their cancer, they're suffering, nutritionally. And if their bodies don't have adequate nutrition, I mean, I don't know where the studies are, but perhaps the impact of poor nutrition, of food insecurity on health. Do you see any studies that reveal higher death rates for people within that 36% rate?
So we're working on that now. I think a lot of people have been interested in the financial consequences of cancer and are starting to study that. And so, our survey that we did was a survey where we just asked people about a past time and asked them to report whether they were food insecure during those 12 months after they were diagnosed with cancer. What we need to do now is more research around just what you're asking about and understand how does food insecurity impact your cancer outcomes or other health outcomes. We know from other disease settings like diabetes or hypertension that people who are food insecure have poor symptom control and have difficulty with their different disease sort of states. And so we want to understand among prostate cancer survivors, how is it impacting your risk of recurrence or your overall survival, and really be able to make that link very clear. Because I think once that link is clear, then we can really advocate for screening for food insecurity and addressing food insecurity in oncology as a way to improve people's health outcomes.
Yeah, and are there other terms for food insecurity? In other words, food insecurity, I mean, I'm a social worker. That sounds to me like an emotional or psychosocial issue. And, in many ways, of course, it is. But in a real hardcore, matter-of-fact, day-to-day issue, it's about starvation. It's about bad nutrition. It's about bad health. It's about friends and family not having the benefit of of the cancer patient's resources to feed them, like children or grandchildren living within that family unit, or a spouse partner, and we could go on and on. But it seems like a very soft. I mean, it's not your fault, but I mean, it seems like a very soft term for a very, very dire and critical issue. What do you think?
I absolutely agree. I think a lot of people get nervous around the term hunger. It's not exactly the same as food insecurity, because food insecurity is a more technical term about being able to access enough healthy food for all of your daily needs. And but what we're often talking about is hunger. And the idea that patients are going hungry is something that no one, is willing to talk about. When you think about the financial consequences of cancer and people say, oh, drug prices are really high and there's all these things, those are sort of large policy issues. But when you drill down to the actual consequences for the patient or their families, I think that's when you can hit on what some of the really dire sort of needs and consequences of this problem are, and they can be people going hungry.
Yeah, and it's worth just overstating a bit more. It's 36% of cancer patients in the United States are to some degree, if not entirely, going hungry. Is that right?
Perhaps. I mean, that was our study in New Mexico. There are other studies that it really depends what the population that you're looking in. Certainly people who have lower incomes to start with, people who are younger. We see, people in rural areas. There are some groups who seem to have higher proportions of food insecurity, and then other studies that have been done find lower prevalences, so it sort of ranges between, I think the studies that I have seen, between about 17% and 56%, based on the population that's surveyed, seem to be reporting food insecurity. But again, that's higher than what we know for the United States as a whole. So we do think that this is a particular problem that's impacting cancer patients and their families.
So let's talk a bit about disparities and underserved communities relative to food insecurity and hunger. Do you understand, has there been any investigation of Black men versus white men and hunger with prostate cancer or any other kind of cancer?
Not that I know of in terms of comparing Black and white. Certainly, we have a paper that's coming out in the journal Cancer pretty soon, where we did a study in metropolitan Detroit that is all African American cancer survivors, and we see there that there is a high prevalence of food insecurity, and that was the top most common sort of health-related social need that was mentioned. So people were asked about food insecurity, they were asked about housing instability and transportation issues and all of those things. And food insecurity rose to the top in terms of being the most common problem that people faced.
And around LGBTQ patients versus heterosexual patients?
Certainly, it isn't something that we have looked at the moment, but I have a colleague who is actively researching sort of social needs within that community and finding that there are many financial consequences, especially because of sort of long-term systemic disparities in how people are treated in the medical system, and often sort of later stage cancer diagnoses that then end up being something that you see a lot of financial consequences that come with that. And so I think it would not surprise me if when we do the study, that we will see that there are disparities in terms of the financial consequences and higher food insecurity there as well.
And is food insecurity purely and only related to economic challenges? For example, are there ways to understand whether the upper 10% of wealth in the United States suffers a degree of food insecurity comparable to middle-income people?
So it's an issue of resources. I don't know that it's all economic. It can also be, as we talked a little bit about earlier, a question of having access to food because of where you live. So we know that both in very rural areas as well as in inner cities, where there are not as many grocery stores that have fresh produce and things, we see food insecurity. So it's not only about money, it's about access to food as well.
Yeah, any disparate, I could go through a list of underserved populations and such, but veterans are a big issue, a big cohort a big grouping in our prostate cancer community. Do you see anything unique around food insecurity in veteran population?
That's a really good idea that you're giving me, to be able to research that and to look into it further. It's not something that we have looked at the moment.
Yeah, you could sort of imagine, like in a sort of not very sophisticated construction, but that, veterans have more of a, I'm going to take care of it kind of attitude, and may say, I don't need lunch today, right, but I do need my pill. But really, I wonder if that really plays out that way. And we'd be happy to work with you on that. We have a large veteran population in our support group community. So, and I'm sure a lot of guys would be happy to be surveyed around that. The idea of doctors and patients who come to a consult and they weigh less than they did 3 months earlier. the doctor may ascribe that to cancer or treatment or medication, but do you find, or do you know one way or the other if that's actually a point of confusion where the patient just may not say, I couldn't afford to pay for breakfast for the last 3 months or something?
Yeah, I think that, weight change, of course, when people are going through cancer treatment isn't uncommon. And you have people who are also interested in losing weight. You have people who may be losing weight because of the drugs that they're taking. There are a lot of reasons. So that's not a great marker of food insecurity and problems that people may have. We're really advocating for universal food insecurity screening in the clinic because I think people don't necessarily bring this issue to their doctors. And I think, as you were pointing out around why you might see higher food insecurity with veterans was, a lot of people don't want to talk about this. They're really working hard to be able to take their medicine, to show up to appointments, to do everything that they've been told they need to do. And so unless you directly ask people and you directly ask every person, then I think you're not going to really understand the depth of this problem. So we hope that our research is getting the awareness around how common food insecurity is among cancer survivors. And then we can say, why not ask every person who comes into the clinic? There are 2 questions that you can ask around food insecurity that asks people whether they ever had to skip meals or not eat as much because they didn't have the money to afford food. And you can ask these questions pretty easily in a way that's culturally sensitive and keeps it anonymous, and then have those people who seem to be experiencing food insecurity referred for food assistance.
Yeah, so what are those questions? Ask our audience. Go ahead. So
the 2 questions that are pretty commonly used ask people whether in the last 12 months they ever had to skip meals or their food ran out before they had the opportunity to acquire more food. And whether they worried that could happen. And so it's both, did it happen or did you worry that it happened? And people who say that was often true in the last 12 months, we find that that's a pretty good way of discriminating between those who are experiencing food insecurity and those who are food secure.
Based on what we were just talking, let me suggest or just throw out a possible third question. Are there foods that you would have liked to have purchased or eaten during the last 3 months that you were unable to? And that goes to the heart of fresh vegetables and fruits, organic stuff. If you can't afford it, then, you could have a full pantry and a full belly, but if it's all starches and carbohydrates or I don't know. I have no clue about nutrition, but if it's the bad stuff versus the desirable good stuff, that's not good either, I guess. Right? Yeah.
Yeah. And that's something that we also find a lot of people around the time of a cancer diagnosis. It's often what we call sort of a teachable moment where people are really interested in changing their nutrition habits. I can say none of us eat the way that we maybe want to eat all of the time. We may overindulge in fats and sweets and, alcohol and other things that we think, we should maybe cut that out of our diet a bit more, right? And so often right around diagnosis, people are feeling like, okay, I'd like to make a change and I'd like to eat healthy, eat more fresh fruits and vegetables. But there seems to be a pervasive feeling that eating healthy takes a lot of money. So often, we find that not only do people want to make a change in their diet and try to incorporate more fresh fruits and vegetables, but people feel like that may be out of their reach financially because it's expensive to do so. And so another thing that we're interested in working on is this idea of how can you eat healthy on a budget? How can you bust some of those myths around eating healthy being much more expensive? Because it doesn't really need to be, but it takes a bit of creativity to figure out how to incorporate more fruits and vegetables and lean protein and that sort of thing into your diet when you're really struggling to afford all of the food that you might want to eat.
Yeah, and that is so important. And, I'll say, we would love to work on this as an organization. We'd love to work on this more. It's so easy to suggest to patients in the prostate cancer realm, do the Mediterranean diet, but there's cost to some of that. Salmon is expensive, particularly the salmon that's not farm raised,
right. The sort of wild caught salmon.
Wild, yeah. And things like that. I know there's an extremely large, there's another prostate cancer organization that, pushes diet and, has cookbooks and has, fundraising schemes around diet and all. But when you price out what they're suggesting, very few people can afford it, and it's extraordinary how they don't get that, and it's extraordinary how patients are just sort of made to feel depressed or weakened because they can't aspire, they aspire but fail to achieve the things that are being told are good for them. But really there are alternatives that are affordable, and there are opportunities, for getting organic stuff or at least, fresh stuff, fresh fruits and vegetables, and even fresh meats, if that's, your taste, through transportation now that weren't available. Typically we could look at Amazon now owning Whole Foods. There are extraordinary opportunities for food delivery that didn't exist 5 years ago or even last year. And in this COVID time, of course, I think our delivery people are equal in heroism to our physicians, just a different skill set and opportunity, but they're, putting their lives at risk as well. I hesitate to sort of advocate for more work for delivery people. On the other hand, it's a pathway towards better health in a pandemic and even in a non-pandemic time. It may be the way for us to get food to rural areas and such. And by encouraging scale, make things less expensive, perhaps, What can doctors do and why aren't they doing more of it to help patients around food insecurity?
Well, you have to remember that when people go in for an appointment, the first and most important thing is to address the current concern, which is prostate cancer, right? And so doctor-patient visits are typically short and they're filled with a lot of important information that needs to go from the doctor to the patient and from the patient to the doctor, ideally, if you have a good relationship and you're, working towards shared decision-making. There should be a conversation around treatment and about your symptoms and all of those things. So often it's not in the realm of the patient and physician interaction that these sorts of things happen. It's sort of pushed sometimes to patient navigators or social workers to then ask more about some of the health-related social needs. So things like food and housing and financial instability and those sorts of things that we often see. But we'd like to bring it in so that physicians understand if it is an issue that comes up during the clinic visit, then they can make the proper referral or be the first point of contact to have that conversation so that it's not something that gets pushed to the back burner always, and that may be the primary concern of the patient that day. So I think there are opportunities to involve physicians in the conversation around food insecurity. It's not where it's typically happened, though. It's often something that is a sort of secondary need to the current medical condition that's going on during that visit.
what haven't we discussed yet that you think is critical or at least interesting for our patient listeners?
Yeah, so I think, we've done some of the research around raising awareness of food insecurity and that this is a problem. But the next step is certainly to figure out how do we start to screen for food insecurity in oncology clinics, and how do we address it among those who are food insecure. And that's where I think research, partnering with patients and caregivers and understanding the true experience. Obviously, I have not had prostate cancer. It's not something that I can speak to. And so for me, it's really important to be able to hear from people who are experiencing it and want to participate, and make sure that the interventions and the programs and things that we develop to address food insecurity are really patient-driven.
So, Dr. McDougall, thank you very much for your career, for your dedication to patients, for raising an extraordinarily important and novel issue. Novel to not in the sense that it's just emerging, but that it's just being put at the front of the conversation. And I hope our talk today enhances that, builds more awareness of food insecurity among cancer patients. I mean, it just sucks. It's basically it. So thank you and welcome to our conference.
Thank you very much.